Welcome to our first video of 2018. We're going to address the current available changes to Medicare for 2018. As usual, you're listening to myself, Kim Caldwell, and my partner, Fanny Pacheco. We're both managing partners at our boutique insurance brokerage, PB Individual Insurance, specializing in providing healthcare solutions to seniors. We are based and service Medicare beneficiaries in the great state of California. Because of this, we have tailored our videos for our California residents.
We always stress with our Medicare clients that the constant with Medicare is that there is always change. More change could come during the year, but as of January 1st, 2018, here's our synopsis of the changes that could impact you. We are addressing changes in Medicare itself, but many of you have Medicare Supplement or Medicare Advantage plans where these changes will be addressed by your particular plan.
In 2018, every Medicare beneficiary will receive new Medicare cards. This is exceptional news. These new Medicare cards will no longer have your Medicare claim number as you or your spouse's Social Security number. Instead, you'll be assigned a totally random personalized number to use as your Medicare claim number. This is a fantastic change as it will eliminate the exposure to identity theft you potentially have each time you show your Medicare card. As you can see, these cards will have a fresh new design, but for the most part, the layout will be the same. Your name underneath your new Medicare claim number, and below that, the effective dates of your Part A and B. These cards are projected to arrive anytime after April 2018 through April 2019. You will, however, be able to use either card up until January 2020.
Changes to original Medicare Part A. Medicare Part A covers inpatient hospital, skilled nursing facility, and some home health care services. About 99% of Medicare beneficiaries do not have a Part A premium since they have at least 40 quarters of Medicare-covered employment. If you refer to the chart on this slide, you will see the changes summarized. There's a deductible when admitted to a hospital. In 2017, that deductible was $1,316. In 2018, it will increase by $24 to $1,340. The Part A deductible covers beneficiaries' share of costs for the first 60 days of Medicare-covered inpatient hospital care. In 2018, beneficiaries must pay a coinsurance amount of $335 per day for the 61st through 90th day of hospitalization. Last year, it was $329. You will also pay $670 per day for lifetime reserve days. Last year, it was $658. For beneficiaries in skilled nursing facilities, the daily coinsurance for days 21 through 100 of extended care services in a benefit period will be $167.50 in 2018. It was $164.50 in 2017.
Changes to Medicare Part B. Medicare Part B covers physician services, outpatient hospital services, certain home health services, durable medical equipment, and many preventative services. The standard monthly premium for Medicare Part B enrollees will be $134 for 2018, the same amount as in 2017. Not to get too much into the details, but there will be changes to those individuals who locked in their Part B premium. This will vary depending when and how you pay your premium and could impact you anywhere from 2% to 28% in 2018. Beneficiaries with higher incomes have paid higher Medicare Part B monthly premiums or income-related monthly adjustment amounts. There are some changes to these premium amounts in 2018. The essential difference in 2018 is that there has been a tier added, as highlighted on this chart, and the highest tier amount has been lowered. There is some good news. The annual deductible for Part B will remain unchanged for 2018 at $183. This is great news for our Medicare Supplement G policyholders. With Medicare Supplement G, you get the same benefits as an F, but you must pay the Part B deductible first. So having a stable Part B deductible is beneficial to those policyholders. Remember, if you have Medicare Advantage plan instead of Original Medicare, you should reference your Medicare Advantage benefit summary for 2018. Medicare Advantage plans take your original Medicare Part A and B benefits and create their own cost structure. For example, many MAPD plans include the Part B A deductible, so the cost increase I mentioned earlier would not even impact you. If you have a Medicare Supplement Policy F, your policy will cover all of these increases. However, as a result, you may see some increases in your overall premium rate.
Part D prescription drug plans. Hopefully, all Part D policyholders reviewed their drug plans during the annual election period and got yourself signed up for the right plan in 2018. Some of the changes you will see in your Part D plans are the Part D deductible. If your plan has a deductible, the deductible has increased from $400 in 2017 to $405 in 2018. Again, not to get into the crazy details of Part D, but many of you have heard of the donut hole. This is reached when your costs combined with the insurance carrier's cost for your drugs reach a certain threshold. In 2017, the threshold was $3,700. In 2018, the threshold is $3,750. Once you are in this donut hole, your out-of-pocket cost can be significant. You stay in this donut hole until you reach what is called the out-of-pocket threshold. This means that your out-of-pocket costs reach a certain level. In 2017, this level was $4,950, and in 2018, it is $5,000. Typically, your cost for drugs can be managed if you are able to take a generic version of the drugs in the market. This is why it is essential that you review your drugs each year during the AEP to ensure that your current plan covers your drugs. Part D also assesses an additional premium for high-income earners. This has also changed to the new tiers that are being used by Part B. The chart reflects those changes.
Now that we've addressed the changes to original Medicare Part A and B, we're going to speak to those changes that may impact Medicare beneficiaries who have a Medicare Advantage plan or Medicare supplements, also known as Medigap. As referenced earlier, you should check your MAPD benefit summary to see if there are any changes to your out-of-pocket costs. One of the more generic changes we have seen, and it is good news, is that if you are paying a premium for your Medicare Advantage, you may see a decrease in premiums, but you might also potentially see an increase in out-of-pocket charges.
Medicare supplements are also changing. Here are some of the most important changes taking place. However, please note that what is being represented here is for our California beneficiaries. The high F plan deductible is being raised from $2,200 to $2,240. We have noticed that so far Anthem and HealthNet have kept their standard rates the same for 2018. This could change, but as of January, no announcements have been made. AARP, UHC, and Blue Shield have both announced rate increases for 2018, so be sure to do some comparisons during your birthday month to see if there are other carriers with better premiums. Blue Shield is also offering a 7% household discount to potentially offset the increase. So if you have two Blue Shield Medicare supplement policyholders living at the same address, you should reach out to your broker to get them to process this discount. Anthem is offering an innovative F plan, which includes all of the standardized F plan benefits, but adds in a vision and hearing plan. This innovative F plan is perhaps the most comprehensive supplement plan available. That is it for our synopsis of what is new in Medicare 2018. We hope you enjoyed it. We know that there's a lot to process, and quite frankly, some of these changes and updates may not specifically apply to you. Each Medicare plan has unique needs and characteristics. We make it our business to know these changes so we can advise our clients on the best course of action going forward. Feel free to reach out to Kim or myself if you have any questions about these changes and how they may affect you.